So I must tell you about this miracle worker, this jack of all trades, this Dr. Andrew Gostein. Yeah, I mean, just a miracle worker, really. So he's responsible. He's the reason that 100 of the Northwestern hospitals put in thermal cameras. Yes, it was all him. And what's amazing about him is, well, he's an anesthesiologist, okay? But he graduated medical school in like 2013. So he was basically in his residency in 14 and 15. And then in 2015, he decided, there's all these problems in the hospital that need fixing by AI. Yeah, I guess that just came, he's in residency. I mean, residency is usually really hard on doctors. But, he was just fixing everything with AI. Yeah. I mean, well, you can see who the investor is there at the top, okay? But just so people understand, after medical school, especially for an anesthesiologist, they're in residency for like 4 or 5 years. So in 2015, because he had graduated in 2013, he's just getting his feet wet. And so instead of, focusing on the patients and the things he should be, well, he was just finding all these ways that they could bring more AI and sensors and cameras and all sorts of stuff into Northwestern even before the thermal cameras got there. It's amazing. So he started up in 2015 in the middle of his residency. He started up an AI startup company called Whiteboard Coordinator. Isn't that amazing? Andrew Gostein's startup aims to make hospitals more efficient, but when the coronavirus hit Chicago, he pivoted to keeping them safer. Way to go, Doogie. I mean, amazing. I mean, he had to have, it was 2020. You had to have still been in your residency. Still, you weren't fully on your own yet. I can't imagine you would be. Residency is like 4 or 5 years after medical school. But you'll understand why in a minute. Gostein is a critical care anesthesiologist at Northwestern's Medicine's Hospital in Lake Forest, caring for 60 COVID-19 patients. He also is the CEO of Whiteboard Coordinator Inc., a startup that had a network of 400 cameras and other sensors deployed across Northwestern's 10 hospitals before the pandemic. Yeah, like I said, jack of all trade. After the virus, the hospital said it was having a hard time screening people coming in for COVID-19 using conventional temperature probes and asked if his company could help. Oh, yeah. Because those temperature probes they're really difficult to use. Okay. The thing is, you should understand about the thermal cameras that take your temp, they're like 50-50 accurate. 10 days later, that's how fast this miracle worker was. 10 days after Northwestern, the top of the chain there, asked him for help. And even seasoned anesthesiologists were like, what's going on here? Like, I would be too. Like, who do you think you are? He clearly was not cared about patients. You'll understand why this happened. There's more to this. So 10 days later, that's how quick he was. The startup had thermal cameras linked to its network installed at 31 entrances to the hospitals. They detected about a dozen cases of fever in 6,000 people coming through the doors each day. You know what, Doogie? Where I was located at Northwestern in 2020, they were never put in the waiting room of the ER. They weren't for the patients. They were for us. Yeah, we all had to be herded in through the ambulance bay, and then they put them in the lobby for visitors after they opened up, but never for the patients. So I guess downtown they did it a little different. Okay. And then I guess Northwestern asked him to help with asked Whiteboard for a digital window into COVID-19 rooms. They wanted to limit nurses' exposure to the virus and reduce the need for protective gear that was in high demand. So the startup deployed another 400 cameras sporting night vision and microphones across the 10 hospitals. Oh, okay. They use Whiteboard's network of NVIDIA GPUs to transcode the video stream so they can be viewed securely. Securely, really? Okay. Let's see. Whiteboard Systems also supports Bluetooth RFID sensors for a range of patient monitoring, inventory tracking, resource scheduling, and security apps. One hospital increased the use of its operating rooms 27% while reducing its costs, thanks to his startup, OR scheduling system. Yeah, I mean, he is just a miracle worker. The pandemic spawned orders from 100 hospitals for Whiteboard's thermal cameras. The startup currently has at least one of its systems installed in a total of 22 hospitals. Our biggest problem is sourcing cameras and other hardware we need because supply chains are in disarray. Oh, okay. Got it. So what's interesting is when you look a little further into good old Doogie here, it says that Andrew Gostein's company, Whiteboard Coordinator, now it's called Artisight, was directly involved with the thermal cameras that Northwestern installed. Northwestern Medicine asked him to help with getting these. And Andrew Gostein, who works with Whiteboard Coordinator, included deploying thermal imaging technology in hospitals. During the COVID-19 pandemic, his startup provided the thermal cameras to hospitals for temperature screening with their systems installed in 100 of Northwestern's hospitals. While his company, Whiteboard Coordinator, now Artisight, developed and deployed the thermal camera systems, available sources do not name the manufacturer or supplier of the camera themselves. Really, Andrew? I can tell you who it is. Yes, it's a Chinese telecom company that President Trump in his first term had blacklisted in 2019. See, if you in Silicon Valley wanted to be smart at all, you maybe should have, filed down the serial number off of the back of them. Because, see, I took pictures of the back of them that you put in the hospital I was at. So you didn't, and that's why you won't reveal who the manufacturer is. Because you put in, you in Silicon Valley, NVIDIA put in national security threat to all of the patients, visitors, and staff because they were blacklisted. Blacklisted in 2019. Andrew Gostein developed significant connections to Silicon Valley through both his education and business activities. He completed a critical care fellowship at Stanford Healthcare right there in the heart of Silicon Valley. And additionally, Artisight, his company, secured investments from, of course, major Silicon venture capitalists. So, Doogie, you should have done a little bit better job because, see, well, I was a nurse in one of Northwestern's hospital, and I took pictures of the cameras that were put in by your startup, you and Silicon Valley startup, and NVIDIA. And they were blacklisted. So you put everybody in danger, so did Silicon Valley, because you should listen to the leader of the country. Because maybe you don't know it, but hospitals are part of critical infrastructure. So you had no right to put your national security risk cameras that were totally capable of facial recognition in any of your hospitals. So, oh, and by the way, Doogie, the name of the company of where you got your cameras is called Dua, a Chinese telecom company.